ahwe bi wo hono mo na etime aboa mecha wo se de bia efie ha no mo se me de metena se a bibia me ye bia e bibia ebeboa ye nipa yankasa ya brabo yenwu ya yetia sinkwa de na ehuhia se yetime hwe ya pomudi esu yie na etime ayeden aboa me ne umienu enkwa wo hwe eye ba akopwe apomudi nso so de ehunsu ehia si usika bia egu baby na me si usika no kra wo ho na se apomudi ne nkoyi ya obedia enjoy sa sika no ene yesu ade afa migraine ho ene sa yare we no yehu ne se eye normal yehu ne se eye normal yehu ne se ne meme se de eye me amesi me num nso pe me ho atome ene enya ekukudam ewo fie ha nko ade obetimi ediye adomu yie ne yetimi ehu yare na nkasa ne fare ba mtena se amese ene no ye hwe cost de ede sa yare ne ba eden ene de sa yare ne ba ye wi ya hwe effect no eba ensonso ede ba nipa ya brabom ya hwe eno nso ne ya hwe ye solution ebe de ne yetu ase kra ensa embabio sa ensemfo amiensa we ana enan we ena ene ye ne doctor etifie ha ne mu a ye ba betwetwe ehon komo na meka wo se dwumekuo bi ene bo yasene na yetimini sa edwumedie ede ebro okoje aman herbal center ono ene ohwe se sa apomudin papa fie ene fiada die yede ebebro bebi bia uwo bia eno ti me twa me ho sema akwakoje aboafo nkra to me ba doctor ene ye ne etena se wofia no meyi ne di akere na ene nso so de no yede atoto so na yetimi yede asori so ene efiada wose yetimi ekoje ya home mame twa me ho enkombra sisia ene o ma pense mu na ye ne o mo asua ade yie ye ne orthodox aha okoji aman herbal center ya rebe ena ya kwankro ewo wusuo bebi ba akopɛ ena wose wodan weni ekohwe na etime aboa eye okoji aman herbal center ya re bia se de etie bia eti di ya re se de etie bia wakoho a entime enkoda no eno ane se obefre okoji aman herbal center na omotime di yankasa ya ha ban etime ede asawo ya re na onsusu wetime ayede ade wo ho meka we se ko Facebook eye hot tv Ghana na wa like wa subscribe na dwumede na etumu edu ekire na wodi bechi wo Facebook na me sure so obehye na afoforo nso so enya bi ahwe na make sure say love button ne star na we miemia so say ya na etime aboa me ne umie no ana me ne doctor panyipa na ewo fi ha na mode bia me ka ne say oye ka ne say usuma banzo nya so wenyi papa na eba ne se ne dwumu mu a odi ho akotin ye papa na o kira de nso a o make sure so obekire ma wate ase ono enene ye ne ba bedidi enkomo ofia no mo se ye fa ne Dr. Daniel edi na so ya na me pese bebo ejeja ne so bebo madaku bi ono onim ne ho ono no ye general practitioner na afenso so owo Kedi Medical Center ono na ne ba betwetwe enkomo afasa migraine yarewe ehun yare bia edi nipa mu akoten papa na ese nipa ha nipa mame ma dog akwaba na enen soso de no wontimi emfa endomye dog
hello
akwaba
Yaseshia
ya che papa bibi aboko de nyankopon ase ene a yeseshia de ne yeshia etina sesenso so anache se adisuane nko a ena yede eba ene ye kasa afa migraine eye me nkan se eye yare a eye komo a mo ena mo betimi a kire se eye komo because mo ena eye mo edwuma a mo ye enti ye hwe di kan hwe sa yare no kra no eye di ade forte me pa cho be so bodi ma kan se me pa cho Facebook fo no mo betimi a follow eye wo hono mo etwegu e wo hono mo sesia enti Facebook fo no so mo betimi a follow yen e wo hono mo ma share link na mo yen nyina enti no mo ntimi en follow hono mo na etimi ayede aboa yen so do enkwani
okay eri kan meda wetie for bebre so ase any mo staff for inviting me back to the show. And then also Kedi Medical staff, your CEO, Mr. David Awuni, my medical director, Dr. Philip, and then also the staff in general, especially to the administrator, Mr. Nathaniel Eggman, and all the staffs at Kedi. Yes, so today we are talking about migraine headaches. Yes, so with migraine headache, no, it's of a growing concern. So to define the migraine headache, no, yeah, we classify the migraine headache as it's a form of a headache, which we will say it's a primary headache, which causes recurrent episodes of moderate to severe headache, usually on either one side of the head. We say unilateral on one side of the head. Now let me break the word primary headache now. I say, so there are mainly two types of headache. Classically, we have the primary headache and the secondary headache. Now you can't primary headache na in your brain na so to say it has no this disease is of a primary cause. We are trying to let you know say as for sayare no yen sheda any cause. For example, you have hypertension. Hypertension in most cases no is primary in nature. Primary nature say ye ni adepotin di BP say nebeka no or ye kasemo no. We don't know what is bringing about hypertension, but in any case it's happening. Then we also have secondary causes of a disease. A secondary cause of a disease, now that means you can identify near edebano. So for example, back to headache, say you have a headache, ubinya tipaya mostly. Ubinya tipaya, winya tipaya, na why she, you can attribute it to something like a malaria. So that means say some headaches are secondary in nature. That means there is an underlying cause edeba. So you can have malaria giving you a headache, you can have typhoid giving you a headache, you can have common cold giving you a headache, you can have a pneumonia or any forms of respiratory infections, cyberma or headache. But when you talk about primary headaches, for this type of headaches, no, we do not know the obvious cause. We only look at triggers, any risk factors in Myanmar, we are a bit Myanmar, so that is where migraine headache fall under. In Myanmar, identifying the exact cause no it makes it difficult. But niema ye hu say nipa we or experience a migraine headache per the definition am kind no. It is a primary headache which causes recurrent. Not just say in the nyana the next time no e be nyana e so into one of activity say oh when you headache na forever and ever you not get headache.
Yes, men can so can ho akosha typhoid bi mu
thank you
and malaria bi mu
no
by ban say hu ni say adefo fro
na we deal with. So it is recurrent and it is the pain no anoye den kind of moderate to severe pain. So in pain so you classify oyawa your mild pain na ensheda enyaya. But with migraine headache we are looking at it from moderate not just say ya no edimu kosi yawa anoye den pa. In so no migraine headache it doesn't start from mild headaches. So this headache na we are not talking about say one am hona oti ayo ya kakra na wanu nsuo na no. But this one the headache is moderate na just anoye ya na asa akwakoye even more severe. That is the type of headache you are talking about today, migraine headaches. So, and with this type of headache, like I said, in addition, it is usually on one side of the head.
It's just one of it.
So sometimes, yes, it just have, and sometimes it can be bilateral, that is both sides of the head. And in location-wise, it's either on the frontal part, so on the frontal part, or either on the frontal part and a little on this side. So frontotemporal distribution. Inti ya onijinani say, I say watching the panitimu half no, ijinani say now spread it in this direction. Okay. And it is also described as a throbbing or pulsating headache. Yeah, the battery Rebecca say, I say oh bo that dwabi will beating king adiana say adene Rebecca say home.
Okay.
Tipaya home. Okay. What is I say a hono is beating elbow be very good. That is that. So imagine, and the pain is not mild, it's moderate to severe. And see, that is what migraine is. It is very painful.
My share be share kwanya efaso eba yen nipa ayem wadwumai emrebe na hu sa na sem pempen so be na nipa duru of say common say otimi experiences are migraine.
Okay, that's a very good question. So we are looking at its epidemiology, how common the disease is. So which make I say there are some people in their family it runs through, others too it's not.
Okay.
So first of all, I would say in as much as yen diagnosis in collaborate say more migraine headaches it starts from that period.
Okay.
But it's not so common. But children also do experience migraine headaches. But the prevalence Rebecca say a very common during abra nipa ne rura ne puberty.
Okay.
We see in mu. So right from say washa say obasha say obun insa ekono ne teen age So from 13, 14, 15 onwards going that is when the disease starts. I mean, that is when it is very common. And it is common amongst women than in men. So if you take, let's say, a population of 100 people, you will find 18% of women having migraine, as against 6% of men are almost experiencing the same problem.
Okay. Yeah, but by cost, but any kind of identity and money and do saying
yes. So with women in particular, we are looking at other factors play a role. We are looking at what we call hormonal factors. Okay. So basically here say we call it the secondary sexual characteristics be develop no for say the body increasing body weight near that. So we are looking at the hormones that are in play here. We are looking at estrogen. What you saying? You're looking at progesterone. These two hormones in play. So when these hormones starts being produced in large quantities now, at a time now, all shots so be insano. The person experiences what we call some fluctuations. I say a costro now perform. So when the estrogen levels dip down now, prior to some few days or the headache can come. Likewise, so we bun in area now, what sign ovulation area no. As a watun kosuan area no, right after that period no, the hormones also dip. Then the headache can also rise. So that's why it makes it more common in women.
I don't know, you can say it's a bi keke and a shasiye kakra and a baby done a way and you say a be on my genetic we busu bi mu e wo hono mo. But I'm sure obi anu de eni ebusu mu. Ne yamfa e ma ne de anya mfa to ho kakra. Me bu minsa before a beba no. It's me experiences I de ne kakra. matu me ko so wi anase me ye we wi no etimi esaba eboabo no saa na de ma saa yare no.
Okay, it's not just say, I mean, that is the yare in essence, like we are talking about, no. That is the yare in essence, no. Into the enye say, say na meka no, obane beshasi so bun sa no beshasi nya de sedic no. That is the disease.
Okay.
But there are other causes. So I know we come there. There are other causes. So a my yare nankasa edimu.
Edimu. Okay. Mami ntwa me ho enkoje aboa fon kratso na yeba na yebwewura ye courses nimu den poten na ede yare no ede ebreye ne ekwan a ye fa so a yare no te se ebeji akonwa woni pedua no mu etena na meka so okoje aman herbal center ene bo ye chi dom ma de se dwumedie ebro yare be na ye kwankro se ya wo na wo pe eye tipaye eye malaria eye typhoid bebi ba ko pe ene wo se wodan woni ekohwe eye okoje aman herbal center na onfa yankase ya hahan no ene ndua no emfa nsa wo yare wohia hospital wedidie mu keke ebetimi ama wonya ahonto ma yenko na so ye hono mu na ye ba ye de aka no ebeto aso pra ye say apomuden papa no ye ni ekuku dan betena se ni ye ni omo atwetwe enkomo obi sepa ede ba wapomuden papa efie dwumedie ne na asoso ene ya kasa ya twetwe enkomo afa migraine eho enkomo na ye twi etipaye enye etipaye bia sa keke etipaye ano hyepa eno ho enkomo na ye di wo fi hanom doctor ye di dwaba ma ye nhwe kwan a sa ya rewe etimi benya kwan wo ya brabo mu pa onse bibi bia ebebobo aba nipa no ebi wo ho no yesi ya na ye frefre no ede maye ho we so yare ye frefre de maye ho
pepe I think I like the word that we use yare wo frefre de ma ho
so
like we are saying no the cause is unknown so that means say you woni ne bia wankasa wo ya ebetwetwe aba in as much as say we talked about for women no there are hormonal changes I trigger these types of headache no. So these are the partial triggers. So that is to say everybody have the tendency so between your headache way. But we some kind of lifestyle beer, it can push you to be getting these types of headaches. So now let's look at in your mind between your baby say abano. So when refer risk factors or triggers. That's it. Uye bibia nebe chi tipa ebi say aba. Number one, I think say it's a problem in our country. It's stress. That is the point.
Yeah, one stress.
That is the point. So you see, that means every citizen is at risk. A stress. Yes, stress, and we can break it down further. Stress name man kofunya time and rest. That is sleep. So we are talking about sleep deprivation. That means onyam renda. skipping meals. The jumanti on the dianopa on the area. You understand?
We did the crowd, did the or some crown a day.
Exactly. You're also pushing yourself to get headaches. I mean, your son or your catch and say you have to sleep 8 hours. Yes. You have to eat morning, afternoon, and evening. But it's like these rules change when you grow up. But I think say or say university the same things now here in colonial was school, no?
Okay.
Because if you wake up in the morning and because of your human system, I'm also trying to inform everybody say this is what you're also pushing yourself to be getting. So stress, number one. Stress na embre ndidi anopa. Embre ndidi area. Sometimes it can even go on to evening.
Yeah.
Some people can work through the whole day forgetting class say they have to eat. Then when the headache starts, they think it's malaria. You know, or started say onyambre so enda 2-3 days continuous. Or better 12. No, sorry, 3. Same ekudum. So it becomes a daily routine. Then when the symptoms starts, severe headache. Oh, me got malaria druna menom. With the malaria. Forgetting say one man hombre iodine unrested. So that is the commonest complaint of many patients who visit the hospital or who frequent the hospital. Or the hospital, symptoms of what? Severe headache. Your baby some signs and symptoms, no. Severe headache on one side, very painful. Doctor, with the malaria, my malaria druna menko. When you probe further, you can do all the labs. And with migraine headaches, no, there you to make us say, oh, your lab reporting and it is a clinical diagnosis. So we have to know what your lifestyle is for us to be able to diagnose this disease. It's no continue from where I left off now.
Okay.
Stress is the main thing.
Okay.
Then the next thing, so brenda. So sleep deprivation, skipping meals, and then also the other one. Alcohol.
Hey.
And Sanom.
Won't
say some focus say they experience headache with hangover.
Yeah.
On no Sano that's Soriana Nitiasha says a pino. That is an example of a migraine headache.
Okay. That's Sano.
Yes.
And I got to train about
exactly.
Come on, and
so the factors keeps on going. So maybe you say you are now getting the picture.
Yeah.
And then also intake of caffeine.
Okay.
So you have it in drinks, you have it in dairy products like chocolates. Yes. And even cheese.
As a doctor, I'm a did
Kafra.
Oh, the answer, Doctor Danny, I mean, no. Because what had initiation, here.
Yes.
I mean, so it's part of your life. There was a wijaho.
Yes. So cheese also contains some ingredients via a trigger migraine headache. That's tyramine. But chocolates, it will shock you, contains caffeine. So that one too can give you a migraine headache.
So you're fine, pal.
Exactly. And even red wine. Red wine is also another risk factor. It may trigger someone to get migraine headaches.
Okay.
So likewise, when the DR, that means you're not also going to take water.
Yeah.
So I would also add that poor intake of water can trigger someone to get migraine headaches. Likewise, exposure to loud noise. Didi. It be a didi. Can also. Oh, I want to believe. Loud noise can also trigger migraine headache, and also bright lights.
Really?
Yes. I've been to head some for say on anterior, especially on a hot yes. On anterior market bar try the hood of do baby a cool no na. Say pino. That is an example. Yes, so in your manema to me ma obinya migraine no. It's broad.
Yeah.
So I say she should now dear womb. Never. Not tackle.
My interest had the way. Obi who can be say that 8 hours and an idiot. According to one Casano, so name say Bibia Muka. Obi says news.
Yes.
Something at least going to me under crana 8 hours.
8 hours.
Obi baby say 8 hours and they say me that 12. Now say me sorry 8 hours. Obi so when they say me that 4. I'm matching 4. I me calculate here 8 hours. Now me the sorry. It's still one more. say 8 hours.
Well,
and as a time I was say it's me dano. Yentimi anda sama no matter how I bet time be I bet that biano me 8 hours no class.
I don't know why you obeda 4 a.m. in the name of say from 4 a.m. you calculate it.
Yes, I maybe that for 5, 6, 7, 8, 9, 10, 11, 12. Me say 8
so
hours.
That means before 4 o'clock. No, what was the person doing?
What say obi wo ho no mo a?
Nejuma. Should I put
Nejuma per se. Obi wo ho no ma na no krama.
Okay.
Obeta kete so be mrimria so ontimi enye den enda. Obi on rest time no onya mfa nda o. In as much as say juma oye ne e di modie. Obedu fie na ade asan. But obi di anko du fie di anko dware ya na otokete so a. At least in the next 30 minutes bi di anko say enna ne timi ba. Obi timi da kete so 4 hours, 3 hours na enna emma.
Yes. We recognize that is also a problem, especially with old age. I know that can also happen. But nowadays, we are also seeing these symptoms in younger people. But that means we have to identify the cause. Because in pain for we clearly get it, say it can happen. But in a younger person, I don't really know why until you wait till 4 a.m. I mean, that's too extreme. I know, that is to say, if you can be able to still give your body that 8 hours of sleep, 6 to 8 hours of sleep, I'll say, it's good.
Okay.
Because no matter what, you cannot cheat nature. You pay.
Exactly.
You pay one day with sickness, and when you are sick, you sleep.
You sleep.
So the body has to revive itself. So still on the risk factors, and then I might be to my headaches. Then also we also have something called sex-associated headache.
Okay.
That is with orgasm.
Okay.
That is more common in men. Yes. So that for those people, when they experience orgasm with sex then they get headaches.
They get headache.
That is also another common way. Then with women with menstruation. As you're about to menstruate, you can also experience these types of headaches.
Okay.
Then also weather changes. So weather it also triggers these forms of migraine headaches. So these are some of the risk factors a bit to me actually obi amanenya migraine headaches.
Okay. My answer sa mitibe pa me. Eno kwa na symptoms no bobo ba. Se nyame bi wo ho no bobo ba ye hu ni ntem a na yetimi ayeden aso ano ntem. Ye bi se sa yarewa we nkomo ene ye di wo fi ha no se no. Eye ade bi a etwetwe enkra bi de we fi ha no mo. Then the we fi ha no mo amini se ene se obi wo ho no kana ne nan ehoho na se wodu nsa enia so na ewremu a ene hu se nipa ne kidney eho atochima kakra yare we nso so no emma ye bibisa ma ye.
Yeah, that is a very important point I will raise. So we are looking at the signs and symptoms.
Yeah.
So we are classifying in 2 ways. And for fact's sake, I've also experienced migraine headaches myself.
Oh, really?
Oh, yes. So saying these things, I really understand it because I myself have also experienced this same problem before. And I realized mine too was stress.
Stress in India.
You understand? So I worked on it. Now let's look at the signs and symptoms. So with the signs and symptoms, we are looking at the main being, you say headache. Yeah. So like you said, there's only headache pen and nipa nibinya. Ama we huana. Enya headache pen ubinya. Ama we hunse nipa na eden experience migraine. I like something you said. Say bibi be bo won kaye ana. So senior now will make it that point but from your friend aura.
Okay. So
we have what we call headaches with auras and headaches without auras. Now let me break it down. Aura now. We are talking about brain some dysfunction be a bit to me so impofrimu as in you will experience some things in your body. It can affect your mood. Or why your mood best all of a sudden. It can also affect your vision.
Okay.
You will see some form of flashes of light. I say temporal blindness to your sight. You might not see clearly from the sight of your eyes. Then also even nipaniti will say you might even not be seeing the person clearly. We call it visual auras. Then you can also you might be having some these are sensations on your body. Even your walking can even change. These are temporal some changes be back. Say headache neighbor. So these are what we call the auras, and any patient it occurs in about 25% of patients. And when these auras occur now, it proceeded together into the migraine headaches. So during the time now, I also experienced the same migraine headaches. No, I thought I was getting blind.
Okay.
Because at that time I was consulting. I'm a consulting room early morning. At the point I was like, I was not seeing what I was doing again. The paper was not. I was like, what is going on? So I had to close my eyes and prepare. And so I experienced what we call the visual auras.
Okay.
So at a point I knew it's like some funny feeling. I was like, I'll come to experience this headache. Then it started. So aside that, then you have the patients also who do not experience any auras.
Okay.
Then the headache just come by itself. And when the headache comes out, it can last for 4 good hours, continuous to the next 3 days.
Non-stop.
On and off. No,
so
it increases in intensity another day as time goes on. And with these headaches, it can also come along with you can even vomit. And one that most patients might think say it can be malaria because you understand? So you might experience vomiting, you might experience nausea. Another lights when you cry, it irritates the headache. It makes it difficult to concentrate with work. So at that time, I had to stop what I was doing.
Okay.
Because it made me more even experience the headache the more, because the headache is intense. When you mild, you experience moderate to severe form of pain. So the headache is very intense, and it's usually on one side of the head, like I said. With forehead, eba or temporal region, I say, to say home, and I say yebo bibi woho, and it can increase in intensity. You understand? So these are some of the symptoms, like I said.
Okay.
Then after area and a light store when you don't like it, or even sound. Dede. Internal mechanic say Dede can also trigger the headache. Internal the most patients will tell you say tipane saba, they just want to be in a quiet and a dark place. Or better. And this headache will resolve with sleep.
Okay.
So this is one of the ways of even treating the problem. You yourself, say nobody will tell you. The disease will let you know, say, if you do this for me, I'll be fine. I never knew. So when those symptoms was even happening, I never knew that was even migraine before. To me, I'm a corner and say, Mama, me sometime I'm in Koda. I just closed the room. I just slept off peacefully. And I woke up, the headache was down. I was like, wow. Unyanda. So the headache will even let you know what it wants. Exactly. So these are some of the symptoms how we to me experience it together with auras na mekano. When you be wake kakra on some be sometimes even you can even get a little confused kakra.
Okay.
As a form of the aura, you experiencing the symptoms of the aura before reading the headache even starts and that guy said me I need to me last day when you about 2 hours 30 minutes it to me jina so for 4 good hours to even 3 or even 5 days continuous into be sani pano say tipa need how many days. And remember, even malaria can even give you headache for days.
Yes.
So you have to also weigh all these things, but this one will not come with fever.
Yes.
Where you find one shemba when you far to say be one am yombre. That means say one now how TSU and only being counsel. But this one will give you just the headache. Just the headache, which is very painful. Like I said.
Once when me obi minim se ne de no se maybe enene addition make me bonipia sinitapa se na migraine na hanasa. Ni tit me pie ni to the stand say onyan show coat me person ni tinu room konitini pie no no it's me by in such a way say ni mi coat me ko twetwe ni nyina no adwuri ni timu sakura.
In that case no, like I was saying no, with the headache no, so another symptom so you say uye adwuma no na e matipa ni more. So at that time whatever you are doing into it, the headache increases with exertion, adwuma or any activity. In the banisa na untumi ye ordinary physical activity. Even could be crowd and walk and cry, you feel the pain.
Wow.
So anything that can be a hindrance, no. So I'm not surprised only panoso occasionality
Yeah.
because you feel like even the hair on your head no cry is a problem for you. So you want to just but anything at all cannot trigger the pain. So you just want to feel free. So maybe that is why the individual did what she did. No? Because anything winning a cause problem.
What's made in it in tank you so call nyaya crawl bed down so ama adiache no so. I say emrene dear nyaya dear. My entry solutions. Yɛnhwɛ solutions yɛhu yɛ symptoms yɛhu yɛ signs yɛhu kwan a ɛfa so ɛdeba ɛsɛ ma yɛhwɛ ɛkwan a ɛfa so a yɛbɛtimi etu ase anase yɛbɛhwɛ ano a ɛntimi ɛmma ntoatoa so saa kasa yɛmu no yɛhu bebree but for the sake of some people nso no ma yɛnhwɛ solutions na yɛbɛtimi aboa na afei no yɛmbonra yɛ text messages no momfa number na ɛnto so ɛmma me
like I was saying about with the solution let's then look at risk factors na can wasem because the solution will match all the risk factors na so for example the stress na if say we will be sleepy just for 4 hours in a day and you are not ready to change that lifestyle habitat there is no way you can get better even with medication. The medication will work for a while. One thing about the solution to is this: you will say with treatments you would go with pain medications, but with migraine headaches, no, it gets to a point if you overuse the medications, the medication itself will even give you more headache. Yes. So that will be chronic overuse medication headache as a complication of the disease itself. So that is to say that is when you are not correcting cough by no. So if it is stress, if it is unyamre enda sana power sorry I would why you say you eat at 12 or eat at 1. If you're not ready to change this habitat, then you're not ready to let this disorder of a migraine go. Because or say a treatment for migraine, the patient has a role to play. It is something that cannot be cured, but the patient has a role to play for us to be able to manage this condition. Sad disorder where a friend of migraine headache we know. So if it is alcohol, if you're not ready to quit the lifestyle of taking in alcohol, then you are ready to experience the migraine headaches every day. As part of Naika, no.
And some doctor, I mean, Chawano. Ya really be sure nipa mu and sat me bo. Obi ti say me mayari.
But I remember mayari.
Me mayari said be you omo ijapadi. You on my son.
Oh, okay.
It's me bo. Because me te enkofu say pain no eye severe na so onya kakra bia.
Oh, are you okay?
Na why okay. Ya na ide enu ye heba mu na ya na mo orthodox for no dia na eja school na ntino you guys have another way of solving that issue
problem, yes.
Then the onu so ti bibidru ase no o feel say e basa na say onum kakra e ma ni pain no e kofom ti won say dey tell me the way yes example no say oya obi free baby na opese o ma sa oya oni edum. So no the chin or yaw from
eba likewise.
The sound crofo we no. Then ye be ye. Oh so yaw so no. Yesterday and the Thursday ya me fa car bi so nkofa me nyama bi ma me. And the driver got somewhere no so parking. Oh bre bisa said yasem no chire mu a chire me. So see from ko pack akra bi gum na he was okay. Pay no so ekofom. And so ene ya wie so ma ye hu say oh, Juju baby, no.
Yes. That was nice. But I think you have to be careful. Say driver no boy anka. Oh yeah, driver di anka.
I'm not saying so no. Omo no baby.
Omo no baby. Okay.
We not pain no. Akofom. Because it's very very painful.
I see.
It wasn't me by then.
I understand what you're trying to say.
What he was going
through at that time.
Because you couldn't drive, so you need to give the car to someone to drive. Because the pain was too much. And bastards know why you did. And so and says Marco Acoma who says, who do
now some problems. And alcohol is one factor beer onoma it can affect any part of the body. Alcohol is not spared. I mean, think about it.
Yeah.
Alcohol, you can't mujabroso area, you can't diabetes area. So everywhere you pass, alcohol is there. And then smoking is also even.
Senior.
I mean, think about it. They are all there. Yeah. They are out there when we talk about migraine.
Yeah,
they also play an important role in causing a problem. See, all this lifestyle now. So when you're ready to say ubijaya, it can also cause a problem.
Okay, all right. Dog, yeah, busua, but the text messages na adults so ebi mu here. Ni nyina so addition ni bia na yemfa ba ko mienu bi na yemfa. Okay, we de ne efri adoma nchen. Adoma so pese obisa say say wo ho no mu in fear. I mean she wants to talk about the sexual aspect. O wo ho no mu be say afi ba ko afi mienu no ne be ma enye hweda. One be ma enda ya ebetimi de sa yare ni bi abre no.
No please.
Emfitimi emfebi emba. Okay. We so ede akwesi speeder de ne efi kumase. O say good evening doctor ene wa ma mesua ade bebre na me pese me bisa doctor say ensan ya o say yenja numu o say masima me kan ye bia no ensan me say me wo yefu yare pa e ba ni denden dia o say me pe haban bi na me de fra ensan it's me yefunyare ne ekofom.
That's even dangerous.
The mano.
Because so yefunyare, I want to believe so such as stomach ulcer, if that's what it means.
It's me and chile musa die. Me pacho your number na was screen so for text messages. Send no text messages na yentimi enyi ano enfama. When so there apuma de ne say odi free able kuma heya. I say good evening Akosua, thank you very much for this topic. I say I've been having a severe headache. Likewise to what you just said about someone's own. As soon as mine comes like this, I need ice block.
Yes.
The ice to tunity.
That's just say indeed or experiences something close to migraine, or I can even say so a migraine because as part of treatment, we can also say between the ice packs. Apart from the said in
okay.
Ice packs also helps to relieve the pain.
Okay.
Or the right thing.
Okay. Okay. When so every a Japan man enchen or say opeso obisa doctor say say ya railway tipa ya railway esime moja efri ni pahinim.
Wow. I'll talk about any complications I better.
Okay. All right. Your messages in a dozen in Pesanka, ye be free na fe ne aba we no so na fe ye de apeke course no your messages in a dozen. Where de ne Franco de no o de free touching mine. I say good evening. Today is the second time I'm watching your program. My mom used to have a severe headache. When it happens like this, no one can even go close to her.
I'm presuming say na mama be above age 50 because mama for any.
Okay.
One beautiful thing about migraine is say unyi no as you reach the higher ages no age 40 50 no the headache comes down.
Okay.
So you no longer experience the actual symptoms of migraine no. But when you try age 50 now you have to look out for secondary causes of the headache which can be hypertension.
Okay.
Do you understand? Yeah. Because when you do empeyemuna the symptoms just theoretically in sane etie. When you do empeyema because the pain catch you say niti paina you have to look out for other causes.
Okay.
Which will not just be a migraine.
A migraine, yeah.
Do you understand? Likewise, me they can't nam the answer ni pano can say tipaine. It could also be hypertension.
Okay.
Do you understand? Because likewise, hypertension too can give you very severe headaches. And until you so pyro, likewise you can bleed from the nose.
Okay.
So it's not just the migraine headache no kwana area a bit nyama obintumi ben but obinyi drum pempenso bisana we don't only look out for migraine because elderly people only experience just a few group of people pena ebe experiences symptoms of pure migraine but even in that case no also wash other causes.
Okay. Dog my way obi ebisa say say ya we etipaye ya we ebi wono so pa but ne de ne eya na ne ti ne pan be say 1 day 2 days 3 days na enka eba eno so eyesa migraine ya ni bi anase yare foforo.
So ka say enka eba efinenum sa no peso
say ni winimo say the numo
ye wo ada nyarewa etumi memeke anase etumi behave say migraine so ka senken ba yare bi to say sinusitis cold but with this one no it affects the frontal part of your head ye wo inflama bi ejinajaye bones num ewo ha say your friend is sinuses say mu ye blocked that it can also create tension and give you headache
okay
and also na mo adidi mu na afidi ema nka efri nipa huni mu eba so we should also look out for the disease called sinusitis
okay
bit me cause a headache
okay all right okay when so every ya asanto de ne de no every ablekuma hanumu ya say good evening Akosua, good evening doctor. I want to ask doctor that I have a severe headache. My daughter has it, my son has it. It's only my wife that is not having it, but even that of it no or person obisa say yare a sign nipa ana so no neba will be bear money will be obani will be na yere na bi
one say make I say sometimes no the disease can also occur even in children. That is, there is a component yare no it can occur in families. It has a genetic component itumi eba enam ebusua kumu.
Okay.
It is a very possible, and then those are rare types of migraine headaches, but it's still possible. So I don't doubt what this individual is saying.
Okay.
So far as I know, be because they are from a different family.
From a different family.
Yes.
Okay.
It's not to say the children have inherited what the father is experiencing. In bones and it is possible they also be experiencing similar symptoms just as the man has been experiencing. So in this case, there is that genetic component of the disease.
Okay, let's take two and then move to our last explanation. Then we open our phone lines. This is from Mr. Enim. Mr. Enim Diano Odifree Tadi. I say good evening, Akosua. Good evening, doctor. And then the mama menia jiye pa mi obia mi ye ejumade. I've been working so hard, so hardly do I sleep. If I even get the time, I can't sleep. What can I do about this? Okay, well, so every Jimmy Diane Ewonungwa Hanomo say or say the whole Ginny house is watching APOMUDEN. Akosua, you do all. Ask doctor for me that this headache okay, ask doctor for me that this headache, can I get it when in case I sit where there is much smoke?
Okay. Yes, it's also possible. It's also possible. With smell. With smell. Yeah, it's with smell.
Okay.
Sono, that's sonophobia. Yeah.
Okay. All right. So, good evening, doctor. I'm a DJ. You talk of sound giving headache. I'm a DJ, and most of the time after my work, I feel severe headache, especially when I put the headset in my ears.
Exactly. So you see. And one
then the mo yale come. Let me pick my last text messages and then we move to our last solution and then we pick our phone. Hello, good evening, Akosua. This is Malam from Tamale. I've been watching your show, but today is extraordinary. Thank you very much, Malam. Okay, I want to ask die sono eni ekuku dan betena se ni eni omo atwetwe enkomo obi so okọ empa so a wontime enda obi so se edura na jo a awode no obi so se
can cure it even with more experience with that. No, if you can be able to take good care of yourself, because like I said, no, even if it's a family way now, the trigger still matters. The trigger still matters. If you are making sure you are living a very good life, you are eating well, you are not taking alcohol, and you will have a very good chance of not experiencing the headache so bad like Ubia unborn bride.
Oh, Monfanche, na text message nebi o hono ma yentimi nka doc yanko your last.
Sure.
We no so na afe no yemfa bia your phone lines no emfa ento
so with complications of migraine headache no one risk factor man can want some here usage of contraceptives.
Hey, that is a man.
Yes. So make that to be able to explain one complication of the disease.
Okay.
Apart from say Yarenagasa, and need so much of a problem. It won't kill you.
It will not kill you.
But it will cause you
pain.
Yeah. And the pain will affect your quality of life, I will believe you. I mean, if say a month you're experiencing headache more than 15 days,
yes,
you understand. So the first complication is say it can become chronic.
Okay.
And then a friend of chronic migraine.
Okay.
And in women who use contraceptives, no, almost experience ORS with a headache, like I said, no, they can develop what we call migraine associated stroke. Once I make I say ORS, no, it say okasa can change your vision, onsa, sometimes your mood, or even your walking can change. So this can trigger even a stroke with those who use contraceptives. Say what I say. And then also it can also lead to seizures. Say a stroke can be when you seizure no. These are some of the common complications of migraine, but it's not so bad to say be a hypertension. I need say you one year careful, like it can kill you. No, that is not how migraine behaves. So in the complications, and so way, but the quality of life are ultimately living on a affecting.
No. Okay. Me pa cho mo fa your phone lines no enso so my entem na yen sorry so na ye bre no aye bre. Dog yen koso.
Yes. So these are some of the complications are you run to me the ba. So in preventing the disease no or to control the disease no, I would personally advise say one, you will take in more water.
Okay.
As an individual, obeno munsu bebre. Like we've always been saying, from the first year by with urinary tract infection, we've been saying, say, drink 3 liters of water a day and eat well. And eat well, because there are some people they experience headache right from the time they wake up from bed.
Yes.
That is when they have not eaten. Now I shall say the moment they eat, they are fine. That should tell you, say, these are some of the petty risk factors of the disease. And then also we encourage exercise. Though exercise in itself can be a risk factor. But in exercise, no, we say
dog ubesumo amaye kakra na yenko offer for no so enche. Hello, good evening.
Good evening, ma'am.
If I show dini baby aka se free.
Pacho, medin yes, ameka Africa so.
Esta peja ne suma me kakra wa na nkomo ne nyede.
Pacho, medin yes, ameka Africa so.
All right, Esther yenko enim.
Pacho, na doctor ninya ear polyp if you want me check me yasa na many so type me timenim say migraine.
Okay, all right. Nti ebe yi wa no e de ama o wate obi wo so amaye emfa no dog tie na asem no so nya is it ear problem and I say ear says
hearing something of an ear issue.
Yeah.
So let me classify those things generally. More eye issues, those with ear, those with throat issues, all this, and even a simple problem can trigger a migraine headache in essence. Though in this case, no, you know the underlying problem.
Okay.
So that classically can't be classified as a migraine headache.
Okay.
But anything related to the head, to me, headache.
Okay. All right. Hello. Good evening. Hello. Good evening. Hello. Ofufro so amaye emfa. Me pa cho akonya ne ma na obaso a na wa lowa o TV ne amaye na wagina yie na yetimi atwetwe enkomo mana ayefe. Why? Tini umaye nko ne sa na enyefe dog yeti.
Yes, so like I was saying, no, exercise in itself no plano can even trigger a migraine headache. But in exercise in question, no, say I've seen some cases of people are mobile hospital as a result of non-mobile na headache started near yes you and pan by. Upon questioning this in the banalizes and on DDA.
Okay.
And son of no.
Some koye search omu ko training say o didia and me ma won.
So exercise in itself no can cause it, but exercise ankasa so boa. Working on this headache because of something exercise does. Because yet we can even tell you to go and exercise when we are depressed.
Okay. Hello. Good evening.
Hello.
Good evening, baby. I can say free. Okay. Sprinter is from where? Mami.
The message about 27 so now
next month be number 27 bad ana.
Okay, all right. Doctor be here no the amount. Why say menses about 2010 as next month it be about 2010 eh bad and eh come angry once and was with the menses as well. It's in the ya manefa ho no mo kakra.
But in essence, to answer here, it's not bad, but near my advice is only the menstrual cycle length.
Okay.
Because length in here to be able to tell. Because if you're on a 28-day cycle, you should know, say, we are 20, it's not about last month 27.
Okay.
You should just know.
All right. Hello, good evening. Hello. Good evening, we didn't even be free.
Yeah, good evening.
Me pacho what TV ni wa utie ho a emboa me. Hello, good evening.
Good evening.
We didn't even be free. Lower TV ni ma me showa. Aha, ne ntwe nkomo wa.
Hello.
Afofro wo so amaye emfa no. Oh. Pacho to me ba so a no lower TV no. Utie ho a emmoa yen. Why? Yesrawa. Utie ho a emmoa kra because ye benya feedback wa ha no mo say. Hello, good evening. Hello.
Hello.
Good evening. Udini baby aka say free. That's why I cry.
Hello.
Madam, lower TV ni my wa ni enti o why so why ready ah. Ene de maji ni so studio. Me pa jo akonya ne ba lower TV no. Lower no. Na fe o ma o ho no ma mo mu nkoda. So de wo mu kwakọ bedroom afọ mu kwọ bedroom na yentimi entwetwe enkwọ e wa ha no mo yes lower. Hello, good evening.
Hello.
Pacho dini me be aka say free.
Hello.
One lower TV na. There is a problem. Please check it for us. Why? Yes, Ramwa. Omonti yen kan so yen two omo all right. Nti mun check my yes, Ramo. Okay, all right. Dog, mpacho yen too.
Yes, you know, to be able to also help disease, I was still talking about exercise. Now, make us say exercise. I don't know whether you've exercised your body where you feel so excited in your body.
Exercise,
International conference in my intimate controlling problem. Yeah, make out for me.
Good evening.
Good evening.
Would you maybe I can say free? Benny, ain't going anymore.
Oh, I might say,
What's your name? Okay, all right, Benny. I say, Doctor Beya no dear Mawa. Hello, good evening. We didn't maybe I can say free.
Number 2, so.
My patrama, I will maybe on chair, Mamma Coshe baby, why, ain't you? Why? Yet you. All right, yet universal man, Miss Rowe. Dog, you share a balance AD. Was I not beginning in a meeting?
Well, we didn't get a chance to see Fred and your canoe.
I was not the tip pie and not beginning.
That's it. May be let me put it in context. It may be beer.
Century beer, Baba beer, to me a year be.
It may be so I wouldn't be able to identify exactly what, but with this type of headache, no. Remember I said, say, I know you're ding. And yet the ordinary headache now we experience
Hello, good evening.
Like that.
Good evening.
Good evening, baby. I can say free. Ben is young queen anywhere.
The patrol, like, what is being
Rashes.
I say, you have seen me too, but my right would be chest in the blood.
Okay, all right. Dr. Beyano Diamo. Hello, good evening. Me patrol corner ye move doctor number into screen sumamina and Eddie. The omaji me move doctor number into screen suma. Me patrol number near the to screen is to war feather will be a Fred doctor na eneno and to tre and como na bibia wo hobia with me ashama. Dog.
So this is one thing I did for myself. I'm who say boy me to control this type of headache and I make exercise, because exercise it release, we call them the natural opioids in the body.
Okay.
And now we calm, it makes you excited. Just any more for this hard drugs, tramadol, and more for
okay.
Likewise, when you exercise your body, this is what happens to your body. It release. We say exercise helps with depression.
Okay.
We exercise a new form, some form of new strength in your body. So exercising, the benefit of exercise, no, more than those say in some people, no, in a person with migraine. I mean, don't go and exercise when you're having a migraine attack. I wouldn't advise. But when you are okay, pain free, there's no pain, then you can do some form of exercise. It will do a very good job on your body.
Okay.
Then for women, Rebecca say, if you're on oral contraceptives, I will not discourage anyone from taking oral contraceptives. But if you take it and you experience headaches, I think say it will be a very good reason. Okay. And then also stress, no, like I said, the stress no in our setting. The stress is huge. It's huge. And through the same stress, no, obi migraine, as I track hypertension. Because if you are not sleeping well, you are also giving yourself that chance.
And then it's your problem, oh dog. And nano say, Debia make us say, and comobia, me no be a betina edine, me fat musumidio. And ya unquao. And ya wa utifi unqua. Even ya a good studio had winninano. You see a baby.
Yeah.
And not a problem, Casapa, and me. Let me talk for myself. A your problem. Me 4 o'clock in your metal.
Oh, okay, it's 4 o'clock now.
Ah, me, met so one more.
I saw about what's in your show.
Okay, did you remember you? Kedi for a general one pay up on you.
Oh,
met so what? Many cool. Sometimes I get a time, but when I'm sick, the way I can sleep. And crack time, me say, my favorite show be horse, I'm your parents, me, I mean, Jahodas, me Jahona, my quack, and then obi onya so onya time find out,
but the sleep is not coming. I think in that case, no, we have to investigate the cause.
Yes.
Because the issue with sleep and waking up nankasano is a complex something. Yeah, or say remember I said say unyi nankasano, and that becomes a problem naturally. But in the younger ages, no, we have to identify what is really.
I only have 2 problems in my life: eating and sleeping.
Oh wow! But then you fall under this same problem.
So it's like everything is for me. Eating is my problem. Sleeping is a big problem. That has been my problem in life.
Okay.
It's not that me near Janine so. Yes. I can stay from morning to evening. Men to come.
Your headaches, Viviana.
Mediani say me shoe. Then I'm okay. If I get my water,
yeah, good to go.
I'm okay. If I feel like say me yefu ayame ya, na me say e come ade me ache. But me yefu anya me ya pa dia. If it is possible, ade be che so.
Oh, say I made a statement say yes. You go school I train say sleep 8 hours, eat morning, afternoon and evening. So necessarily, no, we are not eating because we feel like eating. Because some Kolakra, they don't feel like eating, but the mothers force them to eat. That is the same way you say carry into our adulthood.
Okay.
Say, and and I say we are not eating because I feel like I'm hungry, so I want to eat. Because the body needs the food to do something. I think let's establish that fact. You are eating because the body demands the food to work as energy.
I don't know if so obi I experience will be there. Obi on say what's a one more you don't feel like eating. Okay, the body needs it. I need to eat. And so the enemy see one. What do you say woman na was sorry. You know, so sometimes some people need to live on medicine before they can eat. And you know, we ladies now, we don't want to live on that because we need our shape, we need our flat tummy stuff. So we are on ma onum e brona to odidi dia and I just comedy no person odidi. Ono so osuro ni shape.
Then that becomes an eating disorder. That is an eating disorder for females in question.
Exactly.
That is on person say na wa kind on person we can say on person maintain shape.
Yes.
Yes. So we call that anorexia nervosa.
It's very
so,
serious.
No, we have to talk about that one in a broader light.
It's very serious.
Yes, because an any eating disorder on its own.
Dog,
okay, so I would say we've been talking about migraine today, and I'm happy to say we've been able to get this time to discuss this condition in context. And advice I'm man say, malaria.
Okay.
Let me put it in that sense. Enye ya tipai bia benye bia na chese we dey malaria. Feel say wonam ya we ya why you weak. Migraine is another problem that is causing lots of problems. That is severe headaches. Emma confront to me enyo adwuma because when you headache na into me emma to me adwuma. So you might think you also have malaria like I'm saying.
Yeah.
So nema na ebo boss no about having time to sleep, eating well no. See to me the sanema we so kakra. I think say it will go a long way to reduce the cases even in the hospital setting about these forms of migraine headaches.
No? Common.
Yes, it's common.
Very common.
It's very common. It's very common. If you take in a hospital setting now, if you take let's say a day, a doctor who sees about 20 to 50 cases, you might get around 5 cases coming in with migraine on a daily basis.
Wow.
So it is also of a concern. I'll say can was him because any typaibia na hypertension, and then typaibia na for malaria. Sometimes you do all your checks and there is nothing. Then you ask the person how many hours you sleep, and the person tell you I don't even sleep at all. Then you know say hey, you are dealing with these types of headaches. I may can was me. Especially in a man, obi or no monsa, unya embrace man home. So this is a concern. I think say or say pay attention to it. So this will be my final words.
All right, dog. You better was a pass and then so no when you break any year about to train come. Yes, you are dear baby. Trust me as in person. I'm at sea and me share baby. Na me gidi so say wa wo hwe me wo fie so no won so esua bi wo mo afa wo die wo de bia me se nkomo ne edoso de wo hwa eye wo die ne fa ball bra doctor number no na dash screen ne so no fa ne frɛ no bibia wo bia one ne enka me sɔre so na be frɛ me a me nye doctor migraine means me nka ho hwe nkyerɛw de metimi a kyerɛ wa ne say yetipa yare I can't tell you into details. Into dog pe ene betimi ama ehu sunsanso na ekwan a obefa so aso ano. Nyakopo enhwene ya ne Dr. Daniel Jan na etine fi ha no mo etwetwe nkomo ye general practitioner e KD Medical Center ho na owo KD e wo Ablikuma Joma. Is it Joma?
Yeah, my
Ablikuma Joma, right? Yeah. Yes, Joma. Eho na KD Medical Center ewo. Enti so person ne omo twetwe nkoma number no na watch screen no so fa ne omo twetwe enko Facebook for mo fan chame ene mentimi ambo nram akache ankenka mo text messages no mo fan chame pa. Yakopon hye obi bia onya abret na ase ehwe adwumadie no nyame enhwa mo na onya mo kese pa ehia kese pa so enkoma ye executive producer ye Dr. Prophet Osaiku Tapsus papa bibia wo bia Yakopon enhwa na onyo kese sanso ena kokko ejina ho no mo nso a ohwe se bibia ebe solid e wo fi ha no mo se ene ye wo happy birthday e wo ho no mo your birthday e wo ho no mo birthday e wo ho no birthday e wo ho no every mama Vic happy birthday emfama Prophet John Ado papa Mama Vic na ebusu nyina se wo mo do papa na omo ani ko ho omo ani so Nyankopɔ ensure omo ankwatentin ahondin wo mo ma onyinche na anointing no enye kese pa we every mama Vic wo onene mani nyina enedi happy birthday we ede emma Nyankopɔ ensure Sadek Mountain hwe se bibia e solid wo fia light and camera Sadek Mountain sanso na bless hwe se social media hono no hono traffic ebechi hono pa ye na ode amaye Nyankopɔ ensure mo amobra production ni wo fia wo hwe ye nyina nyame ensure Prophet ensure ba Nyankopɔ ensure papa and I love you so much me do pay ye Nyankopɔ emma unkwantentia ahondi wom anointing no enye kese pa Prophet nyame ensure ba ena de no ye di esi ha no mo se ncha kese enkoma kedi director Nyankopɔ ensure obibia uwobia ena de no ye di esi ha no mo se nyame ya aduma Tuesday ye di APOMUDEN papa fie e de bebro na ene ye dwumadie eye okoji amani Herbal Center eye yare ben ene edi wunya se ya wo sunsumu wonam femu baby ba akopɛ ene wo se wodan weni ekohwe eye okoje aman spiritual and herbal center wonfa ahaban enhwano enfama won kire se de obedi aduane papa ama wapomudin esiye ede amma eye baby ba akopɛ okoje aman spiritual and herbal center ene de ne mede si ha edi ne koso eye Akosua Darko makro dasene mesa atenase ewo fi ha no bio bye bye.